Good afternoon. Welcome to Optimal Care Pediatrics, located in St. Lucie West. I'm Dr. Monique Mondesir, a general pediatrician, and with me today is Dr. Samantha Rawlins, an OBGYN with Physicians to Women, and we are going to be discussing preparation for the newborn. All right.
Well, thank you for having me.
You're welcome. First question, what type of foods should a mom eat during pregnancy?
So I usually tell my patients you want to have a lot of protein-rich foods during pregnancy. Pretty much most people who have a normal, healthy American diet should be okay, but there's certain things you definitely want to avoid in pregnancy, such as anything raw, anything that's not cooked. So like no sushi, no eggnog, no unpasteurized milk, and that's because you don't want to get bacteria from the milk that can cause you to have a miscarriage. So, don't go like to a farm and milk a cow and then drink it directly. So you have to have your pasteurized milks.
What about soft cheeses?
Soft cheeses like feta and brie, you want to avoid those in pregnancy as well, unless sometimes you can find on the grocery that says pasteurized. If it isn't, you can use it, but in that case, you want to avoid those. So you want to have more protein. Now, a lot of people think they have to have a lot of meat in pregnancy. And if you look at the palm of your hand, that's about how much meat you need to eat every day, that size. So you don't need to go overboard and have more meat. But that's what you need to do for protein. If you are a vegan, then you're going to increase your beans and your lentils and that sort of thing. You need to have a little bit more food when you're pregnant. And you'll notice as you go further in pregnancy and the baby grows, you notice that you need to eat a little bit more. You're not eating for two. You're not eating for two.
Really?
You just need an extra like half a peanut butter and jelly sandwich. That's all you need more, usually for most people in pregnancy. Yeah. But you want to avoid hot dogs because it has nitrates in it, and nitrates in it, you don't know. We don't really know if that affects like diabetes or brain growth. You also want to avoid
lunch meats.
Lunch meats as well.
Okay.
If you want to, you can have your lunch meat, but you want to just pop it in the microwave and like heat it up for like a minute, and then you can actually eat it in that point. What else do you want to not have in pregnancy? Oh, that's like fish. You don't want to have too much fish, so maybe not more than 2 servings of fish a week. And that's because we have mercury in the fish. So the larger the fish grow, then the more mercury the fish accumulates. So really large, like I think like swordfish, those ones have more nitrites than a smaller fish. So mercury, so you want to avoid those.
Very good to know. Very good. And how much weight should a mom gain during a single pregnancy?
Right. So, it depends on how much you weigh in the first place. So if you have a regular BMI, body mass index, then you want to gain anywhere between 20 and 30 pounds. If you're underweight, you want to gain maybe 30 to 40 pounds. And if you're overweight, you want to gain anywhere between 11 to 20 pounds. So yeah, so you really don't want to gain too much weight, because the more weight you gain, the bigger the baby gets. And you start to think, how are we going to get this baby out of there? So you don't want to get a really big baby. Also, you just want to be more healthy. You don't want to end up with like diabetes in pregnancy because you ate too much sugar the whole time. And eating sugar makes you really develop quite a sweet tooth that is difficult to get rid of once you're done. So if you're having ice cream every day, and you should not be doing that, but if you're doing something like having dessert every day because you're pregnant and the baby wants it, then when you get done with being pregnant, you're still going to want those things, and it's going to be so difficult to break that habit. And then you're going to run into somebody at the Babies R Us when the baby's out, and they're going to say, when is the baby coming? And you're going to want to stab yourself. Why are they asking you that? So don't do that. So you want to have healthy diets. You want to look at your plate, and you want to have as much fruits and vegetables and meat on your plate and less carbs. You can't be having pasta every day. You can't have dessert every day. You just can't do that. And you got to go for a nice walk every evening. Go for a nice walk, get your heart rate up for 15 minutes. Of course, if you're high-risk pregnancy, then don't do that. Do what the doctor tells you. But everybody should be going for a nice walk at least 15 minutes in the evenings.
Okay.
Yeah, as long as, when it's not too hot.
All right, that's a good tip about eating the desserts every day.
Don't do that.
Okay. I'll remember that even if I'm not pregnant. It's probably not a good idea to have the desserts every day anyhow.
Healthy fruits, veggies, grapes. Those things taste really good once you get used to it. Your grapes and your cherries and other things like that can be really wonderful desserts.
Okay. Yeah. And how can Can a pregnant mom have alcohol during the pregnancy?
No alcohol. And I've had patients leave me because I told them no alcohol is okay in pregnancy. And we see people on TV doing it, and it's, not a good idea because alcohol is the number one risk factor for preventable mental retardation. And you don't want to do that to your kid. Why would you want, and even if it comes out, your kid's smart. Maybe if you weren't drinking, your kid could have been brilliant. So you don't want to have any alcohol during pregnancy. And yeah, years ago, people used to do that, but years ago, people didn't used to wash their hands. So, we know that that's not a good idea. So no alcohol.
So how can alcohol affect a growing fetus?
So you can end up with fetal alcohol syndrome. And the thing is, we don't know how much alcohol it takes to end up with fetal alcohol syndrome. It's because some of us may have the enzyme that doesn't allow us to break down the alcohol or makes it break down slower, and the alcohol stays in our system, and you end up with fetal alcohol syndrome. So you don't want to do that. Yeah.
Okay. So not even a glass of wine is safe.
No.
Very good. Okay. And what effect can cigarette smoking or being around secondhand smoke be on a pregnancy?
So cigarette smoking is so bad for babies, and even just being around secondhand smoke, or because you're still getting the smoke in your system, and that's so bad for the babies developing vasculature, the blood vessels, the babies developing lungs, and then the babies can end up with lifelong lung disease because they were exposed to cigarette smoke in pregnancy, or even before you were pregnant, because that's bad for your blood vessels. So now you're going to make a placenta with crummy blood vessels, and the baby just won't get the oxygen the baby needs. And same thing for marijuana. Anything that you're putting in your body that's not oxygen is not helping anything. So you don't need that. Now, there are many different uses for marijuana, and we have no studies that are going to say this is good or this is bad. And we are not allowed to test anything on pregnant people, so we'll never know. But if you can avoid it, you definitely want to avoid cigarettes. You want to avoid secondhand smoke. If you have family and friends who smoke, you can ask them to, wash their clothes and take off that sweater before they come in the house, or whatever the case may be. And if you just quit, it's hard. I know it's harder than quitting a bad boyfriend, but if you can quit smoking before you get pregnant, it'll be great. And reduce smoking, of course.
Excellent. And why is folic acid recommended before becoming pregnant?
Okay, so everybody who's like childbearing age 15 to 45 should have folic acid in their diet. And folic acid is responsible for the formation of the spine of the baby. And by the time you miss your period, the spine is already formed, and then it just gets bigger from there. So you don't want to end up with a hole in the spine, a spina bifida. So, and it's one of the reasons why people sometimes have miscarriages in the first trimester. So it's so preventable. If you know you're thinking about being pregnant, then you should, just have like a gummy a day. You don't have to take the big prenatal vitamins. Those ones are so hard to swallow, but just a little folate tablet every day. A lot of our foods are enriched, like the bread, and enriched with folic acid as well. But if you're trying to get pregnant, then you should have a folic acid every day. And you want to have it 2 months before you get pregnant, and then the 1 month after that.
Okay. Are there any other supplements that an expecting mom should have or avoid?
Let's see. You want to avoid having more than your recommended daily allowance of things. And that's usually in those hair and nail pills that, you see in the drugstore for hair and nails. Those are usually, if you look at it, it's like 500 times the recommended daily allowance. So you want to avoid those things. But you do want to have more of your B12, your B6. And if you have that before you get pregnant, we think that it also helps to prevent nausea, vomiting in pregnancy. So if you stock, I don't even remember, I think it's 25 milligrams of B12. If you have that before you get pregnant, then you're less likely to end up with nausea and vomiting in pregnancy. Your other fat-soluble vitamins A, D, E, and K, you want to have that. Vitamin D is so important, as well as calcium, because you're making a baby with bones and teeth, and you don't want all the calcium to come out of your bones and teeth, and you end up with osteoporosis, or you end up with cavities. So you want to make sure you're taking that calcium supplement and the vitamin D. And your vitamin D has to be sufficient in your system, or else all the calcium you take in is just going to go right out. So it won't get absorbed in your body.
Are all those vitamins in the prenatal?
That's a good question. Some prenatals have maybe more B6, more B12. Most prenatals do not have enough calcium because, as you know, calcium is a very clunky, chunky thing, and it makes the vitamins too big, and then nobody wants to buy them or swallow them. So most prenatal vitamins don't have enough. You need about 1,500 milligrams of calcium a day. So that's like 3 to 4 servings of dairy. Okay. Or you can get a separate calcium chewable tablet. Take that as well.
Very good. And should pregnant women get the flu shot?
Yes, 100%. Pregnant women should get the flu shot. ACOG, American College of Obstetricians and Gynecologists, highly recommend that everybody get the flu shot, and it's totally okay for use in pregnancy. A couple years ago, we had the flu miss, so pregnant people and elderly people were not to get, and I think children were not supposed to get the flu miss, or could children get it? I don't know.
So children could get it, but it was removed from the market last year. It's reintroduced this year. Okay. This year, I'm just carrying the shots.
Right. So the pregnant people can get the shot anytime in pregnancy. If you know, and it's annually, so if you know you're going to be getting pregnant, you should get it, because when you get pregnant, and the more pregnant you become, as you know, it's hard to breathe. You know, the uterus comes up to here and you can't barely take a breath. So imagine if you get the flu on top of that. It's horrible. And also, it can be fatal if you get the flu. So you definitely want to get the flu shot. And then also, you want to think about getting the whooping cough vaccine, the Tdap. And you want to get that in the 3rd trimester, because if you get it in the 3rd trimester, then it passes the antibodies onto the baby, and the baby gets protection from the whooping cough. So that's a good idea. Also, anybody who's going to be helping you to take care of the baby, you should encourage them to get their flu shot and the whooping cough vaccine as well.
Excellent. And the next question, should expecting moms stop driving at some point in the pregnancy?
No, I don't think that you need to stop driving. I mean, I think years ago when everybody had like a stick shift and no power drive, what do you call it? Power steering. What was it? You have to do a 5-point turn. It might have been harder for you, but no, you can drive in pregnancy as long as if you think you're not feeling well, if you feel faint or dizzy, then you got to pull over. But yeah, you can totally drive.
Well, I actually get this question a lot, so I'm sure you get this one too. Can moms-to-be have their hair colored or other treatments like keratin and relaxers?
So yes, you can have your hair colored. There are no studies that say yes, but there are no studies that say no. But it seems as if the amount of chemical that is on our dead hair, so the hair is, I don't have hair, but but the amount of color that's on your hair rarely gets into the scalp, and then very rarely gets into your bloodstream, and then does not get through to the placenta. So yes, you can get your hair colored, you can get your hair relaxed, or whatever it is you want to do. You just want to make sure that you do it in a well-ventilated space, because sometimes it gives off a lot of chemicals, and then the dryer, and they're blowing your hair out, and you can end up feeling quite dizzy and overheated in a situation like that. Other thing you want to do is when you're cleaning the house, and we have a lot of fumes with our chemicals that we use to clean the tub and the floor, you want to open the window and make sure that it's also well ventilated, so you don't end up passing out or whatever. Mm-hmm. If you work in a hair color factory, or you're around constant chemicals, then you need to talk to your provider about that, and they'll determine if it's an occupational hazard for you to be pregnant around certain chemicals, and what adjustments you can make during your pregnancy.
Okay, excellent. Mm-hmm. Excellent. And at what point in the pregnancy do you discuss breastfeeding goals?
We talk about it a lot of times. We talk about it at the first visit, probably at the 18-week visit, the 28-week visit, and the 36-week visit. And some people already know that they definitely want to breastfeed. Some people think they don't want to, and we encourage breastfeeding to happen once the baby's born. It passes passive immunity to the baby, and just the breast is best. However, I myself don't make a thing where it's so important. It is important, but I don't want, if for some reason you just don't make enough milk, or I don't want you to feel like you're a failure. So I encourage it, but if it's not working for you, if you can only nurse sometimes and supplement other times, then that has to be what it has to be. But it's best if you can breastfeed, and then pump. You can pump it. If you have to go back to work, you can pump the milk and then give it to the baby. Mm-hmm. Some people, the baby just won't latch properly. So in that case, you can pump and then feed it to the baby. And then that way your husband can help you.
Support, right, with pumping. But there's lots of support, and you can also go to your pediatrician who can I would help you latch baby. There's a lot of breastfeeding resources also to help work through the latching process if there's issues, or lactation consultants as well. So lots and lots of resources.
And it helps decrease ear infections, gastrointestinal disease. And if you have some milk that's stored in the freezer and your baby this happened to me, and my baby got a bad GI bug. So I pull it out of the freezer and I fed it to her, and she got better so much faster.
Exactly.
Because
antibodies.
Yeah, the antibodies. Yeah. So that's good.
Excellent. And is it advisable for an expecting mom to start pumping before the baby is born and to start storing that milk?
Right. So no, we don't advise that, because when you start manipulating the breast and tweaking the nipples and pumping, it causes your body to let down oxytocin, and that can get you to start contracting, and you can end up having preterm labor. So we don't advise that you start doing that before. My mother was a midwife, and she said that when she was younger that they would tell women about, like, after 36 weeks to start manipulating the nipples to kind of get them, I don't know, in shape for the baby latching.
Yeah.
But we don't advise that anymore. So that's that. Something else I was thinking about that.
Well, the colostrum.
Yeah.
Right? We want to save the colostrum for
we do.
baby when baby's actually born.
What was that question again?
Oh, that one was, should mom start pumping before the birth?
Yeah. Okay. Also, if you were to do that, you're taking protein from your body that you really need to be giving to the baby in the uterus. So if you have another baby at home that you're breastfeeding while you're pregnant, you have to, at some point in time, really think about weaning this baby, because you're burning the candle at both ends, and you're just going to be working on fumes. You can't be feeding a baby a nice protein milk, like say you had a 6-month-old and now you're pregnant with another baby. So you really have to wean that baby, unfortunately. I mean, people do it all around the world. So, in places when there's not like a grocery store that they can go to, then they have to give the baby what they can. But it's better not to be pregnant and nursing at the same time.
Okay, excellent. So that does bring me to the next question. What do you recommend in regards to spacing of pregnancies? You just mentioned that you're pregnant and you have a 6-month-old,
right.
9-month-old.
So the optimal spacing, if this is a test question, is 18 months. You want to have 18 months between this baby and that baby, because it gives your body a time to regain the nutrients that it lost during pregnancy and breastfeeding, and even the delivery, depending how was your delivery. Did you have a C-section? Does your body need even more time to heal? Does your uterine incision need even more time to heal? Because once we make that incision on your uterus and we close it up, it has to heal. And if you get pregnant too soon, then you can end up tearing that incision open, and that is catastrophic. So you just really want to give your body that time to heal, regain the nutrients, and even enjoy the baby. You don't want to have baby on top of baby. I mean, some people do and they love it, and that's great. But you really want to enjoy that baby that you can have at home.
Okay, thank you. And how will an expecting mom or expecting parents know when it's time to go to the hospital?
Okay, so I usually tell our patients, we tell them at every visit, if you start to have regular painful contractions, some people won't even realize it's contractions. Some people have really bad menstrual cramps, don't even notice anything. They're like, what was that about? So if you have back pain and you realize it keeps happening, I tell them drink a bottle of water, because sometimes we're just dehydrated. And if you drink a bottle of water and the contractions keep coming, then what you want to do is you want to go to the hospital, call your doctor. They'll tell you what they really want you to do. And you can head over to the hospital. They'll put you on the monitor. They'll see if you're contracting. They'll check your cervix. So that if you find the baby's not moving appropriately, say the baby, I usually tell everybody you want to make sure the baby moves at least 10 times in the hour after breakfast, in the hour after lunch, and in the hour after dinner. And I tell people to check with meals, because sometimes you can have a really busy day and it could be 5 p.m. and you think, wow, did the baby move today? So you want to keep an eye on the baby's movements when the baby's in the uterus. So if you find the baby's not moving appropriately like the baby normally does, then you have to head over to the hospital, because maybe the amniotic fluid is low, or maybe the baby's not getting oxygen through the placenta that the baby needs to be getting. And if your water breaks, you got to go to the hospital. Some people stay home and think, well, my water broke, but I'm not having any contractions. I'm just going to stay here and wait. But sometimes once the water breaks, that barrier of infection that prevents infection from going from the vagina. And there's bacteria in our vaginas, that's okay there, but it has no business being up in your uterus. And so once the water breaks, that barrier protection is gone, and bacteria can ascend and start to cause an inflammation. So once the water breaks, you got to go to the hospital so they can figure out what's the next step.
Okay. I saw we got a question
about one more thing. I'm sorry.
Yes,
and bleeding. If you have bleeding, you got to go to the hospital.
Okay.
Okay.
Broken water and bleeding. One of our questions is how long you can breastfeed for. It's really a personal choice. You could continue as long as you like. Remember, it's also cultural. There are some cultures where you have 6 and 7-year-olds breastfeeding. So it just depends. There is no cutoff age. It's really up to mom, up to baby, and when they're ready.
But if you can breastfeed for 6 months, that would be so great. If you could breastfeed for a year, that's good too.
Exactly. All right. And, is there value in creating a birth plan?
So yeah, if you want to do a birth plan, you can do that. I think everybody's birth plan is healthy mom and healthy baby. That's what we all want. But birth plans are nice in that it kind of gives you an idea of questions that you may want to come to your prenatal visit and ask your doctor, do you do this? Do you do that? What do you think about that? So it allows for an interaction between the patient and the physician, or the patient and the midwife, that, just kind of brings up things that you may want to talk about before you actually come to the hospital and labor. But everybody should remember, you have to be flexible. Every baby's got their own story. Sometimes people make a birth plan that they don't want their water broken, and that's the first thing that happens. The water breaks at home, and then that throws off their whole birth plan. So you just have to remember to be flexible.
Okay, that's what I say. We're not always in charge at that point. What should expecting moms pack in the hospital bag? What should be in that bag?
So I saw that question and I thought, these days at the hospital, they give you everything. So what not to bring? Don't bring a pillow. To me, everybody who brings a pillow, it turns into a circus. But yeah, you can bring a pillow. Bring a pillow, bring your favorite socks. Sometimes people have on their lucky socks or their favorite socks. And I think if these are your favorite socks, there's going to be a time you want to take them off, or they're just never going to be quite right again. So you want to have maybe your toothbrush, maybe floss if you like to floss a lot. Anything you might need for your ID card and your insurance card, bring that for sure. And then you don't really need a whole lot, because usually once you have the baby, you can then say to your husband, your partner, your mom, whoever, go to the house and bring whatever it is. But I would definitely pack a small bag with, maybe you don't even need to bring pads, because they send you home with pads.
And the underwear.
Yeah, and those little disposable underwear.
Mm-hmm.
They send you home with all of that. So if there's anything particularly you want, some people bring soothing music that they can listen to while they're in labor. But these days we don't even do that, because everybody's got it on their phones. It used to be people would bring the CD player with the music. We don't do that anymore.
And then the babies will usually get a little undershirt,
right.
So you don't have to bring a bunch of clothes. But if you wanted to bring a special outfit for baby,
for the pictures,
for pictures, or for baby to go home in, you can certainly do that.
Yeah.
But again, they do have a lot of items for baby. But if you wanted to bring some of your own, that's fine.
Don't bring any candles. We're not allowed to light smoke or incense or candles or anything like that in the hospital, because we can't have open flame around oxygen.
Right.
So, yeah.
All right. And are there any benefits to having the circumcision done in the hospital?
So OBGYNs traditionally have been trained to do circumcision, so we all do them. But some don't do it anymore. So you can either get it done with your OBGYN, and you can ask them if they still do it. But a lot of times they refer to the pediatrician who can do it in the outpatient scenario. Sometimes the pediatric urologist will do it. So is there a benefit? I mean, you can get it out of the way and get it done if you want to do that. But a lot of times people's pediatricians will do them also. Some scenarios when so circumcision is it recommended? It's not recommended by the AAP.
So I think if it is a personal choice, there's some benefits to it, but you're perfectly fine to not have a child circumcised. Right. And I think about the whole rest of the world. Vast majority of men are not circumcised. So it's, again, a personal choice. Mm-hmm. So parents can decide what they want to do. And, if there's ever an expecting family and we wanted to have that discussion in depth, we certainly could. But I usually will refer out to a urologist. I do not do them in-house.
Right. And then sometimes when the baby's born, like if one testicle hasn't descended, we don't do it because you're going to end up having to see the urologist. So we figure, let the urologist do it.
Yeah, there is a few scenarios where we would not recommend it. So that's why the baby, of course, has to be passing urine, has to be examined thoroughly first.
And sometimes if the baby's penis is just a little smaller, so like if the baby's preemie and the penis is a little on the smaller side, then we won't do it at that point. But it's totally a choice, and you can talk with your insurance company about that also in terms of do they actually reimburse or allow you to get it? Will they cover it?
It depends on the plan as well. Next question, you mentioned preemies. So what is a premature birth, and how can the birth experience differ between a preterm and full term?
So a premature baby is any baby that's born before 37 weeks of gestation. So 40 weeks of gestation is your due date. So 37 weeks, any baby born at 36 weeks and 6 days and prior to that is considered a premature baby. And having a premature baby can be very stressful. Some babies are born and they do great, but some babies are born and they need a lot of additional help. They may end up in the NICU. They may end up needing oxygen, antibiotics, and also being born premature is a risk factor for heart disease later on in life. So that's other things that you have to think about. Babies who are premature are at increased risk for diabetes and cardiovascular disease. I meet people all the time who tell me that they had early heart attacks and it turns out that they were born prematurely. But that is a little bit stressful, and a lot of times the baby may have to stay in the NICU and then mom gets to go home and the baby has to stay in the hospital. So now mom will have to go back and forth to the hospital to visit with the baby. But a lot of hospitals have nesting rooms where you can stay in and be close to the baby, probably the week before the baby goes home, so you can get that interaction going on.
Okay.
And most NICUs encourage baby moms to pump and bring the milk, or even you can come in and nurse the baby in the NICU as well.
Excellent. And that's not to say that all babies, right? Just to clarify that all babies will have cardiovascular disease.
No.
Right? Just a
It's a risk factor,
right? Just a risk factor. And we're getting some questions and comments coming in about breastfeeding while pregnant. That some moms have done it while they were pregnant, and they had good outcomes as well.
Go for it. Absolutely go for it. Whatever you want to do. But just know that if you're doing that, you want to make sure you increase your protein and your nutrients that you're bringing into your body, because you're going to be doing that. So if you want to do that. Around the world, as Dr. Mondesir said, people do that all around the world, and you can do that. But just know that sometimes when you do that, it does increase your risk for the oxytocin. As we all know, that gets let down from the baby sucking, can then turn around and make you start to contract. So if this is happening to you, then probably you don't want to do that. But if you've been doing it and it's been fine, go for it. Absolutely, because the breast is best.
Okay, well, thank you for clarifying that one. And next question. Oh, this was a question that I had with my first one, and I wanted to know how many people are going to be in the delivery room? Who are the players? Who's there?
I think it's a personal choice these days. I think most hospitals will let you have as many people in the delivery room as you want to. Some people only want their husband in the room. Some people want their husband and their toddler in the room. Some people I've been there and they've had the whole extended family, moms, grandmas, granddads, both sides of the family. So as many people as you want or don't want. I know for myself, I just had my husband there because that was a total personal time with us. My mom was in town, and my mom, as I said, she was a midwife, and she's also she has a PhD in gender studies. So my mom is very intelligent, and she knows that there's a time when, as a mom, maybe you want to step back and give a little space between the husband and the wife. But if you have the family and you want them to all be there, you can all be there. So it's a personal decision with you and with your hospital. So you need to talk with your hospital. If you're having a C-section, then usually we only have one person in the room, in the cesarean section room, in the OR, as a support person for the patient. And if for some reason it's like an emergency and we have to put you to sleep, and this rarely happens, then we don't have anybody in the room with you. But that rarely happens. That's usually something really is going on. But usually,
so then there's the doctor and a midwife, or a doctor and a nurse
in the delivery room?
Yeah, for a vaginal birth.
So usually it's just a midwife. There's a nurse. There's a midwife who's doing the delivery, or the doctor. Then there's a nurse who's your nurse, and then there's a nurse who's the baby's nurse in the room. And then once the baby's born, if we need anybody else to come in for whatever reason, then we'll have other people come in.
Okay. Excellent. And if a mom chooses, we're going back to breastfeeding again. If a mom chooses to breastfeed her newborn, can the medications given during labor and in the period immediately after birth affect the baby?
So usually when people deliver vaginally, they don't really need more than just maybe Tylenol or ibuprofen. I've had people not take anything at all. I guess it depends on if they end up having a vaginal laceration, if it's a small laceration, if it's a bigger laceration. And usually we try to treat just with ibuprofen or anti-inflammatory like that, maybe a shot of Toradol if you're very uncomfortable, and then whatever pericare that you do with the nurses in your room. After cesarean section though, sometimes people do, the first day after cesarean section, most people are not really that uncomfortable, because if they had an epidural, the anesthesiologist will load the epidural with medication, so they don't need any extra medication. Some people do take a Percocet here and there, and that is totally okay for use with breastfeeding afterwards. But everyone's different. If people have, maybe people had issues with substance abuse in the past, and sometimes they may need a little bit more medication. And so that would be a discussion for you to have with your physician, your midwife, and with the pediatrician at that time. So everyone's a little bit different.
Okay. Then we got a question came in. What options do you recommend for pain control during labor other than an epidural?
So, I highly recommend that people take a birthing class. If you take a birthing class, it kind of lets you know what to expect, and you can start thinking about your options at that time. And sometimes when you know what to expect, your anxiety is just a little bit less about the whole process. And then if your anxiety is better, less well controlled, then you're going to have less pain and discomfort. So that's the first step. At our hospital, if you want to, you can get in the tub and you can turn the jacuzzi on, and that's nice. Or you can get in the shower. That's great too. We're also starting a new gas and air, which they've been using. If you watch, what's that show on TV? Call the Midwife. You'll see in England that they use this whole gas and air thing, which is just like the nitrous. And we're starting to have that. Yeah, we're starting to have that at Martin. So if you want to do that, you can do the gas and air thing, and that doesn't get to the baby. That's totally okay. We also have Stadol or morphine. I forget which one is on back order, which you can use, and that sometimes does cause sedation with the baby. But usually we won't give it if you think the baby's about to come. But if the baby's just comes right after, then we usually let the pediatrician know, and then they'll come and make sure that the baby's breathing well. I think that's pretty much the options, other than an epidural.
Okay. And then Rebecca had a question. What about being high risk and having people in the room? So I think she's referring to having a NICU team present.
Oh, okay. Well, if we think that you need to have the NICU team present, then absolutely, we call them right in. So like, say if you're diabetic and you deliver your baby, then they're going to check the baby's sugar and make sure that the baby's sugar isn't too low, and they'll take it from there. And that's really a pediatrician thing. Once the baby comes out, yay, pediatrician.
So the NICU is a neonatologist or a pediatrician who specialized for an additional 3 years in neonates or newborn babies, basically. Okay, so that's who would be in the room for a high-risk delivery.
Mm-hmm. Or if we end up doing a vacuum delivery, then we have the neonatologist or the neonate practitioner come in just to make sure that the baby is fine once the baby's delivered. But most of our nurses are really excellent at resuscitating the baby should the baby need that. But we do have the NICU at our hospital right away as well.
Okay. And so after the delivery, when should moms return for postpartum care?
Okay, so the postpartum period is considered from birth all the way to like the 12th week. And we like to call that the 4th trimester. And you can, everyone's different. Some people, just a phone call. We always, in our practice, we always call the patients the day after they get home. And we're so fortunate that in Martin County, we have nurses that go out to do home visits.
In St. Lucie County.
Yeah,
Both
so
counties.
That's great. So we have people going out to do home visits. And that's so wonderful because, especially if you have a toddler at home, how are you going to pack everybody up and bring them in when you just have a question? So they'll come out, and if you had blood pressure issues when you were pregnant, they'll check with that. They'll check your blood pressure, they'll check your glucose, they'll make sure that everything's going good with latching the baby on. They'll take a peek at the baby's circumcision. They'll look at your incision if you have an incision. They'll just answer questions.
They can check the bilirubin as well, and weigh baby.
Right, and they'll just be very supportive. So it's so nice that you have that. But sometimes some people just want a phone call. We just pick up the phone and call. How are you doing? How is your mood? Are you okay? Are you sad? Are you happy? Do you have support? Are you letting people help you? Because a lot of times when we have a baby, we think, oh, we're the only ones with the breasts. And you feel like you have to do everything and you feel like your husband's doing it wrong. My mother said, as long as he's not putting the diaper on the baby's head, let him. You don't want to, diminish the help that your partner or your spouse or your boyfriend is trying to give you, because then you're going to marginalize them and move them to the side. So you want to make sure that it's inclusive and let other people help you, accept help. And also, since the babies feed like maybe every 2 to 3 to 4 hours when they're first born, you need to let someone else, help you. Like, so you're going to nurse the baby or give the baby a bottle, and then you can give your partner the baby and that person can burp the baby and you can go to sleep. Because sometimes we see patients who will come to their 6-week visit and they haven't slept more than 2 to 3 hours at a clip for 6 weeks. It's not going to help. That's going to throw you right off the deep end. So some of our patients come back most of our patients come at the 4-week for the visit. But some people, depending on what's been going on, we'll have them come at 2 weeks. We'll have them come at 1 week if we want to check the wound. If we just want to talk to them and make sure that that their mood is okay. So it varies depending on the patient.
And can you talk to us about some conditions that need to be closely managed after having a baby?
Right. So some of our patients may have diabetes or hypertension in pregnancy or thyroid disorders, or even maybe history of substance abuse in the past or mood disorders. And so that needs to be monitored after the baby's born. We need to make sure that you have a primary care physician that you're going to go back who's going to be managing your thyroid disease. If you had diabetes, we want to check your glucose 6 weeks after the baby was born. If you had blood pressure issues, eclampsia, preeclampsia, HELLP syndrome, any of those sorts of things, then when the nurse comes out to your house, she's going to check your blood pressure to make sure that you're okay and make sure that you don't need to come back to the hospital or increase your medication or, worst case scenario, have a seizure or stroke. 50% of deaths that happen, maternal mortality, happens after the baby's born. So a lot of times people go home and then we don't hear from them. And so it's important for you to stay in touch with your provider.
Okay, thank you. Mm-hmm. Last question. When can moms start birth control, and what types of birth control can be started after a recent delivery?
So, we usually advise, so birth control is a personal choice, and some people get the Depo-Provera injection right in the hospital before they leave, and some people don't really know when they want to have their next baby. They hadn't even given that a thought yet. So you kind of want to think about birth spacing. When am I planning to have my next baby? If I'm planning on having my next baby in 5 years, then it might be a good idea to get a IUD like the Mirena IUD or the copper IUD. But if you're planning on trying to get pregnant in a year, then you may want to just do a birth control pill, condoms, withdrawal. You just want to give it some kind of thought. Usually we try not to start people on hormones right away because that increases your risk for having blood clots because it makes you more coagulable. But if you're nursing, we give you the progesterone-only birth control pill, which we've been using for years. It doesn't decrease the quality of the milk or the caloric content or the volume of the milk once breastfeeding is established. So we usually do that at the 4-week visit. We encourage our patients not to have intercourse until the baby's at least 6 weeks old for a vaginal delivery and 8 weeks old for cesarean section. But you have to talk with your provider because, for example, if you had a C-section and then you had a wound infection afterwards, then that changes things, right? That, the wound might not have healed as well. So the wound on your incision, on your uterus, not the one we're looking at, but the one on the inside, like if you had fever. So you need to talk with your provider, but you just really want to make sure you have that conversation, and write down the questions you have so that when you come to the doctor, because you're going to be tired, you want to make sure that you don't forget those questions. And you can always call as well.
And then when can you insert the Mirena or the IUD?
So you usually at the 4-week visit, if you say you want to have a Mirena, we order it. And then we have you come back 2 weeks later and we put it in. So as soon as 6 weeks after vaginal delivery, after C-section, you want to wait about 3 months because you don't want to make a hole through the uterine incision. So you want to make sure the uterine incision is very well healed before you put the Mirena in. Now, some people will put it in, and there are studies, and certain groups of people that will put it in right before you leave the hospital, like right before you leave the hospital. But sometimes those ones are a little tricky because those ones might fall out because you think about your uterine, your cervix is like kind of bigger than smaller, or it may become malpositioned. So, but you're not having sex anyway at that point. So you can wait a little bit.
Okay. Excellent. Well, thank you so much for joining us today, Dr. Rawlins. A lot of really, really good information. Thank you. I will post Dr. Rawlins' contact info on our Optimal Care page. And if you have any other questions, certainly write, and we will try to answer them. All the best. Have a wonderful afternoon.
Thank you. Bye.